What's up, you guys? Welcome back to another YouTube Live. We're here with another episode of Jimmy Rants. JimmyRants.com is the website. And as always, if you want to engage in this show, we try to start off live on Instagram, YouTube, and pretty soon we'll be going to Facebook with these as well. But you want to follow the show, go to JimmyRants.com, and you'll see all of the information about this show. It is a show where we talk about nutritional health and some things that happen in headlines, various things that come up here on Jimmy Rants. So go to JimmyRants.com. You'll see that the show starts off sometimes on Instagram Live, sometimes here on YouTube. So go follow me. This is on YouTube. So go follow me live on YouTube whenever I go live. You should get a notification if you click the little bell to remind you when I go live. So go and do that, you guys. I'm Living Low Carb Man on YouTube. So youtube.com/Living Low Carb Man. Make sure you subscribe. I've gotten since I started doing Jimmy Rants with the replays all going on YouTube, I've picked up about 3,000 new followers. So there's a bunch of you Jimmy Rantsers out there. Thank you guys for being here. If you do miss the live, you can actually watch this on replay over on YouTube. So go type in a keyword search, Jimmy Rants. You'll find the past episodes. Definitely follow me on YouTube. Finally, we have the best of the best moments of this here show in podcast form. It's the Jimmy Rants podcast. It's on Apple Podcasts as well as Stitcher. All of these links, you guys, are at JimmyRants.com. Today's Jimmy Rants is all about a brand new study that just came out, and it's about how a low-carb diet provides relief from knee osteoarthritis. So a lot of people deal with chronic pains and knee pain specifically, and they always feel like that the therapy for it is drugs, and then eventually knee surgery. Almost everybody thinks they have to do that. And it's unfortunate because we now know from this research paper I'm about to share about, we now know that that is not necessarily what is needed in order to find health and healing for the knee pain. And so what I want to talk about here today is low-carb keto, you guys, is better than drugs and better than surgery for osteoarthritis in your knee. All right, you guys ready for this? Here we go. Let's start that again. What's that word? Osteoarthritis is the most common form of arthritis in the knee. Research has shown that a low-carb diet performed much better than a low-fat diet for participants in a study about osteoarthritis. Age, obesity, injury, and general joint overuse are all among the risk factors for developing knee osteoarthritis. So this is out of the University of Alabama, Birmingham, and they found that a change in diet reduces the intense pain caused by knee osteoarthritis. This is the most prominent form of arthritis according to all the research findings that were published in the journal Pain Medicine. So it was conducted at the University of Alabama, Birmingham. It showed that a low carbohydrate diet was far more effective in reducing the intensity of pain than a low fat diet. And what they did was they tested, you guys, adults that are in the age group of 65 to 75 who suffer from osteoarthritis. Researchers in the UAB College of Arts and Sciences also found that a low-carb diet specifically increased quality of life and decreased serum levels of adipokine leptin, as well as a marker of oxidative stress. Pretty cool, huh? So the lead researcher of the study, his name Robert Sorge, he's a PhD there, the director of the Pain Collective at the UAB Department of Psychology. He said, our work shows people can reduce their pain simply with a change in diet. How many of you go see your doctor and you tell the doctor you got knee pain? How many of them recommend that you do a change in diet to help with that? I have never heard a mainstream medical doctor offer a nutritional response to any kind of pain. No, never. But now we have research that backs it up. Many medications for pain can host a bunch of side effects that may require other drugs to bring down the side effects. So you ever take a drug and then you need another drug to deal with the impact of the side effects of the first drug, so it makes you take a second one? The beneficial side of our diet, side effects of diet may be things such as reduced risk for heart disease, diabetes, and weight loss, something many drugs simply cannot claim. I love this, you guys. This research out of the University of Alabama, Birmingham is incredible because they're acknowledging that you're getting benefits from a nutritional modality like a low-carb diet that include a reduced risk for heart disease, diabetes, and weight loss, but it's beyond what the diet is doing. What's really neat about it is they're saying a lot of the drugs that you would take for pain, for something like knee osteoarthritis, a lot of the drugs you would take actually increase your risk for heart disease, diabetes, and the ability to lose weight. That's something that's never talked about within mainstream medicine. What is the side effect? What are the unintended consequences of all these medications that people are being put on? What is going on there? And they're not telling you all these raised risks for heart disease, diabetes, and weight loss. So when you use a nutritional modality for healing pain, you get the nice little side effects of not having to have all of those risk factors with the drugs. Pretty cool, huh? So if you're just joining us, we're talking about a brand new study that has just come out from the University of Alabama, Birmingham. And the study found that low-carb ketogenic diets are providing relief from knee osteoarthritis pain without the need for opioids, which is the major pain medication that so many people are getting addicted to, and without the need for knee surgery, which is the eventual thing that happens when people have osteoarthritis in their knee. Because there is no curative treatment for knee osteoarthritis outside of having a total knee replacement. Persistent pain is commonly treated with opioids, acetaminophen, and non-steroidal anti-inflammatory drugs. All of these can have unwanted and unpleasant side effects if they're used over an extended period. And anybody that's had knee pain or any kind of chronic pain, you know it doesn't just go away. So you're going to keep doing those things to try to help with the pain. And what are we doing? What is the consequence of all those drugs that we're taking? It adds up, guys. And all of those medications, by the way, are extraordinarily hard on your liver. And if your liver ain't working well, your body ain't working well. Over-the-counter anti-inflammatory medication side effects include high blood pressure, liver or kidney problems, stomach ulcers and pain, heartburn, allergic reactions such as rash, wheezing, and throat swelling, and a tendency to bleed more, especially when you're taking an aspirin. Other than that, you'll be okay. So we're talking about doing a nutritional modality for helping with osteoarthritis pain. Nutrition. You avoid the unpleasant side effects of drugs. You avoid the need for your knee to be cut up on. This is good, you guys. Opioids may work well for short-term severe pain, but they have very limited usefulness over the long term, and in some cases, they actually perform no better than the over-the-counter drugs. The advantage of a change in diet is that it can be done without long-term anti-inflammatory use or prescription medications. It can also be tailored to your personal tastes and preferences. I don't know about you, but I'd rather eat bacon and eggs and butter and avocado and green leafy vegetables and have that as my sustenance, and it gets rid of my knee pain, than to have to take pain medications. And oh yeah, here's the other thing. You're on the medications because a lot of those inflammatory pathways that are being exacerbated precisely from the bad diet that you're eating. So when you're eating lots of refined carbohydrates in the form of refined grains and refined sugars in your diet, that's making your body much more inflammatory. And let's not forget about the refined vegetable oils as well, the seed oils. These things are all having ramifications on your health. And so if you reduce them and eliminate them eventually from your diet, and you replace them with real whole foods that are full of healthy proteins and fats and all of the good stuff that's in real whole foods, it's little wonder why you see improvement when you start on a low-carb diet in this pain. The advantage of a change in diet is it can be done long-term without any anti-inflammatories or prescription medications. Diet is a great way to reduce the use of pain relievers, improve your general health. Diet will never cure pain, but our work suggests it can reduce it to the point where it does not interfere with daily activities to such a high degree. If you've ever been in pain from any reason, any relief from that pain, you take it. I have sciatica pain in my lower right-hand side of my back. And so I do all kinds of things. I showed earlier on the Jimmy Rants bonus episode where I was on my vibration plate. So I'll step on that thing and get a lymphatic shaking of the body, and that actually helps relieve pain. You can hang upside down on an inverted table, and that helps some of the back pain. I also use CBD oil where I put it directly on top of the outer skin, and that provides relief, as well as sublingually. So I do all kind of tricks to avoid having to take medications. And then, of course, I eat a ketogenic diet, which is a natural anti-inflammatory. The lead researcher also adds that weight loss alone did not reduce pain in study participants. How you lose weight matters. This is the other thing with all this focus of attention on diet and its impact on your weight. They never talk about, well, what are the other ramifications of losing weight? Because I could lose weight pretty easily if I just limited my calories to 500 a day. Would I be healthy? Nope. Would I lose weight? Yep. And they're saying that this pain reduction isn't necessarily just about the weight loss. Here's what they said, you guys. The quality of the diet and the types of foods that you consume have a lot more to do with pain reduction than the weight loss alone, according to the findings. So what they're saying is, what is it that you're eating in your diet that could be causing this pain? And this is what we were talking about earlier with the inflammatory foods that so many people are eating in a traditional kind of standard American diet. They're eating refined sugars, refined grains, refined vegetable seed oils. All of these things are highly, highly inflammatory to the body, which that's why you're feeling the way you feel. Diets such as the Mediterranean diet, which they call a partial low-carb diet, has been shown to reduce inflammation in arthritis patients, self-reported pain in osteoarthritis and rheumatoid arthritis. This previous work supported the new hypothesis that by lowering the intake of refined carbohydrates, oxidative stress would decrease and all this functional pain that people are experiencing would be improved. However, diet intervention studies to date have focused exclusively on self-reported pain and not an assessment of functional pain, which the lead researcher in this new study believes is a better indicator of efficacy. So here's what they did, you guys. They did a randomized controlled trial. Yes, this is what we always talk about. We want to see good science. This is good science. The UAB randomized controlled pilot study of 21 adults. 9 of them were male, 12 of them were female. They tested the efficacy of a low-carb diet and a low-fat diet in adults ages 65 to 75 who currently have knee osteoarthritis. That is the most prominent form of arthritis, by the way, in America. It affects 15% of the U.S. population. So that means almost 1 in 5 of you, a little less than 1 in 5 of you are dealing with this right now that are watching Jimmy Rants. Because of its affinity for the lower weight-bearing joints, it's been one of the leading causes of disability in your lower extremities in the aging population. So here's what they did for the study. They were asked to follow one of 2 dietary interventions or continue to eat as normal over a period of 12 weeks. So here's what they did. This is good study design. They had 2 groups, right? Low fat, low carb. And then they had a 3rd group that was the control. The 3rd group continued to eat just like they were already eating. The other 2 were either randomized, which means just randomly put into the low carb group, or randomly put into the low fat group. They did this for 12 weeks, you guys. So it wasn't a short study. 12 weeks is a pretty good length of time to assess all of this stuff. So they took a look at functional pain, self-reported pain, quality of life, and depression. All were assessed every 3 weeks during the study. So blood was taken before and after the diet intervention was analyzed for oxidative stress. And what they found was the low-carb diet reduced pain intensity and the unpleasantness in some functional pain tasks. They also looked at self-reported pain, especially when compared to the low-fat diet as well as the usual diet participants. The low-carb diet significantly reduced oxidative stress and adipokine leptin compared with the other diets. That's a good thing. That finding was particularly interesting since a reduction in oxidative stress is related to reduced functional pain, or pain that is associated with things that you do every day. So think about just walking to go get the mail at the mailbox. That's a functional test. Think about getting up just to go to the bathroom. That's a functional test. So many things that they looked. To test functional pain, researchers asked participants with knee pain to stand from a sitting position, so that's another functional one, several times during the day, walk a set distance, and then tested their knees for a pain response by repeated stimulation. The tests were meant to replicate the kind of pain that people experience on a day-to-day basis that can limit their function. So the study was spurred by previous research done by this same researcher in animal models that showed a poor quality diet had negative effects on health, the immune system, and recovery from injury. Guys, he did it the right way. This researcher first tested animals, and in that animal model, he created a hypothesis that poor quality diets lead to pain. So then, because he saw the veracity of it in an animal model, he decided to test it in humans. This is the right way to do science. You know, you hear me rail against bad science literally all the time here on Jimmy Rants. I try to point out whenever science is done poorly, but this is where science is done well. And I'm hoping you're getting that loud and clear. Previous research that he did also showed a good diet could reverse many of these changes. So guys, this is a great study. And what I want you to take away from this is we do a lot of things medically that are probably unnecessary. And one of the major things that medicine does, and does often, sadly, is they're so quick to pull the trigger on putting people on an opioid, for example. And we know we've got this huge opioid crisis right now, people getting addicted to these medications for pain. What if it was as simple as a diet change? What if they could just simply tell them, eat a low-carb diet, eat more healthy fats in your diet, go on bacon and eggs in the morning with some avocado and maybe some green leafy vegetables, have a steak and some non-starchy vegetables for dinner, and do that for, you know, a couple months, and then come back and see me and let's test your pain, your functional pain, as they did in this study. Guys, could you imagine the revolution that could happen? Now, the people doing all the knee surgeries making a boatload of money off of people's knee replacement surgery, they're not going to be too happy because they're going to stop having their gravy train. But we don't care about that. What we care about is actually getting people healthier. And if this new study shows us nothing else, it shows us this. Nutrition is so devalued as a modality in healing the body. And I think nutrition is the basis by which everything happens in the body, and why you feel pain, and why you have issues going on. Now, is keto the grand cure-all for everything? It's going to make all your pains go away and you're never going to have any other disease if you go keto? No, do not misunderstand me and don't misrepresent me. This is what the opponents of keto like to say is, oh, every keto proponent thinks it's the panacea for all ailments. We're not saying that, but we are saying that people need to be given the better information. They need to know if their osteoarthritic pain in their knee can actually be healed nutritionally. And if they're not getting that information, why? Don't we want to see patients get better? Don't we want to see them get out of pain? Do we not want them to be addicted to opioids anymore? Why would we not share this information with them? Which is one reason why I wanted to share this on this Jimmy Rants here today. All right, let's see what you guys have to say. Welcome in, welcome in. I am going to scroll all the way back up to the top, and there we are. All right, guys, so amen to the knee arthritis. Ugh, says Darla. Yeah. Low carb has definitely solved my knee pain, says Nancy. Never need knee wrap to sleep or Aleve anymore. That's great. And I know a lot of people, they deal with all of those kinds of things just to tolerate the pain. And I have the sciatica pain, and I know what it feels like. I could not imagine what it's like to have chronic knee pain from osteoarthritis. You're singing my knee song, says Darla. That's awesome. Janet says, my Achilles tendonitis cleared up by the 4th week on keto. Knee pain is gone fast too. Excellent. All right. It disappeared. Hang with me just a second. Alberto said, I will start selling tape to cover the check engine light of cars. I will become a billionaire. Yeah, that's pretty much what they're doing, Alberto, by putting these opioids, putting these poor people on opioids. They already know they're highly, highly addictive, and yet they keep prescribing them. Oh, well, we limit their ability to have them for a long time. Well, here's the thing. They go on the opioid, they get the relief temporarily, but then at some point the pain comes back because they stop taking the opioid. What then? Why not skip to something that will actually fix the problem, to your point, rather than sticking a piece of tape over the check engine light? That didn't solve anything. All it did was kick the can down the road a little bit, and these poor people aren't finding the relief that they need. Which journal was the research published in, Sarah said. So it was in, I said it at the very beginning, the journal is called Pain Medicine. That's the name of the journal. Val says, I know keto has ended a lot of my pain. I rarely take any pain medications. I have one brother who had both knees replaced, another family member in denial about her opioid addiction. Yeah, Christine's dad, he had surgery on his knee. Now, it's helped him a lot to have that surgery on the knee, but he ate a crappy diet for a little while. He's keto now, and he's definitely doing really well. I think it helped him in the recovery from that surgery because he recovered really, really fast. But it's a shame. How many people are getting knee surgery for osteoarthritis needlessly? How many? How many are having to deal with all of the ramifications of that? It's sad to me. Sarah says, do you know if degree of relief was independent of weight loss? Yeah, they said that weight loss was not the benefit that provided this relief, that it was literally what was happening with the diet alone. The reduction in the carbohydrates, especially the refined carbohydrates, they're saying those things were stoking inflammation, and that it wasn't just weight loss alone that was providing the benefit. So thank you for that. I thought I was going to need a knee replacement before starting keto, says Shirley. Now my knees only hurt on occasion. It's amazing how much diet impacts health in a lot of ways. And a lot of people, they don't always think about pain as a part of health that maybe diet could help with. But we know from this study now that it does. It's very profound. Wants to know how they define low carb. So in this story that I read, CDoc, they did not say. So I don't know. Maybe you can find the paper in that medical journal, Pain Medicine. You can actually find the paper to see. but apparently they got some kind of benefit, and I would not be surprised if it was below 50 grams of carbohydrate, but I don't know. They didn't really say explicitly that it was ketogenic level of carbohydrate restriction, but definitely we know low carb is defined as under 100 grams of carbs. Ketogenic tends to be under 50 grams of carbs. So it would be interesting to know. If you find out, CDoc, let me know, because I know you have access to PubMed and all that stuff. Kobe says, my knee pain did poof when I did keto after a couple weeks. That's amazing. Marla says, I would sit in my car after work and cry before making myself get out and up to 3 steps. No tears, no meds with keto, not following the advice to get my knees and hips replaced at 63 years old. Good for you. Kobe says, my sister had a knee replacement, but still in pain 1 year later, still using sugar and margarine. Ugh, that's horrible. Not looking into keto, she isn't, and heavily overweight, losing weight with meal replacement. Yeah. I think I'm turning Japanese, says Jimmy, weight loss is overestimated. Have you read The Obesity Myth, a one-of-a-kind book? No, I have not read that particular book. I don't know who the author is, The Obesity Myth. But obviously, I agree. I don't think weight loss is the be-all, end-all. Getting healthy is the be-all, end-all. Paul Campus. Okay. I'll have to look him up. I've heard of his name before, and I've obviously heard of that book being in this space. But yeah, obviously, I don't think weight loss is the be-all, end-all answer. We've seen this in the diabetes world, where they try to say, oh, well, the reason why your blood sugar and insulin levels get better is the weight loss alone. And yet I've seen studies from various people, very famous one out of the University of Minnesota. What's her name? Mary, I can't remember her last name, but there was a researcher who looked at that, and she found that they controlled diabetes, blood sugar, and insulin apart from the effect of weight loss. So they purposely kept the people from losing weight, but then they changed their diet in such a way so that they could control blood sugar and insulin. And anybody that goes keto, one of the first benefits that you see is your blood sugar and your insulin levels come down, and your inflammation levels come down. All of these things that are signs of really good health markers get better first, and then the weight loss happens. Weight loss is just a happy side effect of the body getting healthy. So yeah, I'm not a fan of making weight loss the primary factor of what you're trying to do with any kind of nutrition or health change. So guys, the bottom line in this Jimmy Rants is we're gonna hear more and more of this kind of research, and kudos once again to the University of Birmingham, Alabama, for daring to do a study about low-carb diets and its impact on pain. You don't really hear a lot of research looking into pain, specifically osteoarthritis pain, which is a major contributor to lower extremity pain that so many people deal with in their joints, specifically their knees. This is good news. We need to shout it from the mountaintops. Look, guys, low-carb keto is better than opioids, better than knee replacement surgery. None of the side effects. It's real whole food. Why would we not embrace real whole food as a way to reduce pain? And we should. And that's why we talked about it here today on Jimmy Rants. That's it for this episode of Jimmy Rants. JimmyRants.com is the website. As always, we try to start off on one of the social media platforms. Generally, it's Instagram. Go follow me there at Living Low Carb Man, LIVINLOWCARBMAN. I tend to do those in the mornings. We've been doing YouTube Live lately, you guys, so go follow me there. If you missed the live, you can watch it anytime on YouTube. Once again, at Living Low Carb Man over on YouTube. Type in a keyword search Jimmy Rants on YouTube. You will find the show. Finally, we have the best of the best moments of this here show in podcast form on the Jimmy Rants podcast over on Apple Podcasts and Stitcher. JimmyRants.com has all of those links in case